Hey there, welcome. So good to have you with me today. Today we are going to touch on a somewhat controversial subject, and that is the contrast, the comparison between North American or Jensenian iridology and holistic iridology, also known as constitutional iridology. So as we are doing this, I would love it if you would take just a moment to let me know in the chat or in the comments, depending on how you're joining me for this, what your background in iridology is. Have you had any training? And if you have, do you have constitutional? Do you have Jensenian? Do you have emotional? What is the style? If I know what your background is, I can do a better job of presenting information that will be relevant and helpful for you. So encourage you to pop in and give me that kind of background. What training do you have in iridology already, if any? And if you don't, that's fine. You can just put none. I'm good if you put none. That, again, gives me information and helps me to be able to tailor our content today to what you are going to need. Now, it looks like Instagram is having a challenge bringing people on board. We'll have to maybe post this later on for our Instagram followers. So I'll do a deeper introduction of myself in a minute, but let's just start with my name is Judith Cobb. I'm a master herbalist, natural nutrition clinical practitioner, and a level 3 IPA certified iridologist and iridology instructor. We're going to be looking at a lot of irides today because we want to be doing a comparison and contrast between Jensenian and constitutional. Now, I was a Jensenian iridologist for the first 10 years of my career as a holistic health coach. And it was those 10 years and that training that made me switch to constitutional. And so we'll look at eyes, and I'll give you that bit of an introduction as to how I would have assessed it as a Jensenian and how I assess it now as a constitutional, just so you can see the differences, particularly if you're doing clinical work. I would love to know as well, are you working as a holistic health coach in some way right now? If you are, just put holistic health coach or HHC in the comments again, so that I know how deep I can go. Because if you're already working as a holistic health coach, then I know you've got your anatomy and physiology, and I can go a little bit deeper. If I know that everybody here is pretty new and doesn't have that, then I'm going to keep it a little more high level, right? This needs to meet your needs. You're investing 35 to 45 minutes of your time with me. And so we need to make sure that this is meeting your needs. Excellent. Thank you so much for letting me know where you're at so that I can tailor this to what you need. Now, the first thing we want to do is look at iridology maps. There are a lot of maps out there, and everybody has one, right? Everybody has one. This is the very first one I ever started with. This is Bernard Jensen's map. And as we look at this, you're going to notice that it is subdivided into little teeny tiny sections. Now, on the chart, they don't look that tiny. But remember, on the chart, these circles that we're using as an iris are about 5 inches across. When you shrink that down to be the size of an actual iris, which is about a 1/2 inch, how big are these sections actually going to be? How easy is it going to be to actually match that all up with your person, right? Bit of a challenge. Well, Ellen Tart Jensen, who's Bernard Jensen's daughter-in-law, updated his chart. She's added more detail. Sometimes more detail is good, like she's added all of the different pancreas zones. We've got 4 pancreas zones in each eye. She's added all of the heart zones that he didn't have, which means there are 3 additional heart zones. And so she's done a great job of updating it, but she's kept the subdivisions and she's subdivided some of it into even smaller sections. So this area right here is this. So again, makes it really, really tough to pinpoint absolutely precisely. What we know about our bodies is our bodies are very similar one to another, but they are also a little bit different one from another. Our organ placements might be slightly different. I actually have one client who has a genetic disorder where all of her internal organs are switched left for right, which means these iris maps are totally useless. I can't use them with her, right? And so if you're off by just a fraction, or maybe your appendix is in a slightly different position, then this map is not going to be accurate. Harry Wolff, who is the father of constitutional iridology in North America, was also pretty subdivisional. He even got things even more specifically defined into tiny, tiny areas, which, yeah, pretty hard to work with that. You know, the kidney, he shows the renal pelvis and things like that, which I don't have a herb that works just on the renal pelvis, so it doesn't really do me a lot of good to know if there's something specifically wrong with just the renal pelvis, right? And so, as much as I love Harry, I'm not in love with his chart. This is Mickey Jones, again, very subdivided, a little more illustrative, which can be helpful, but not very useful for constitutional. What you see on all of these maps is a very medical approach. How do we subdivide the body down into individual little sections so that we can slice and dice and really just focus on tiny things rather than looking at the body as a whole. Now you're going to see, and I know you've seen this online, and I'm hoping none of you are guilty of this if you will already practice iridology. You will see people offering free iris analyses or iris readings. It makes it sound like they're reading tea leaves or something. That doesn't sound very professional as a health practitioner, in my opinion, just my opinion. But you'll see them offering free readings online. Post your pictures and I'll do you a reading. And the challenge with that is, it is saying that you can tell from the eyes exactly where things are going wrong right now just by looking at the iris. Now we know in constitutional, this is different from Jensenian, that the irides reflect your inherent potential. They don't necessarily tell you what's going on right now. Your sclerae will tell you where the hot spots are right now. But the irides, which is what we would see in relation to these maps, tells us what you've inherited, what your strengths and your weaknesses are. Okay, and so this is really important to remember that, that with the Jensenian iridology and with these maps, they are looking to try to guess where your issues are. Now, I say that because as a Jensenian iridologist, whenever I would find a marking and I would say, you have this problem, I was always wrong, right? It did not work. This is the dynamic iridology map. It started out as a map created by Bill Caradonna, who was my constitutional teacher. And research has been ongoing. And so with his permission, I updated it to add the 4 pancreas zones, the extra areas for the heart, things like that. But you'll notice here, we haven't subdivided anything. Where on the previous maps, you would see areas for knee, leg, foot, arm, shoulder. Those are not generally metabolically active areas. They don't necessarily affect or impact the constitution. So with constitutional iridology, we are looking at organs of all kinds that can have an impact on how the body functions, right? And so when we look at this, we are only including those organs. We're not breaking the kidney down to include the renal pelvis or the urethra or the ureters. It is simply kidney. We've got bladder, but again, we've got nothing for your urethra or ureters connecting these two. We've got the major organs. Well, we've got all of the organs actually showing up on here. And so this means that we are able to focus on the constitution, on the organ as a whole. And this is why it is so important to understand how the body works, because we may see a constitutional thing, a constitutional indicator in the eye, and then we might see a particular marking in an area. For example, we might see the person is prone to being over acid and they have a genetic marking in the lung. and they're coming to us with a respiratory issue. Well, we understand exactly what's going on then. We know that the lung is the weak link and that it's being impacted by this person's predisposition towards being over acid. And so we're going to then ask the questions first about diet and lifestyle, and then next about emotions, because we know that every health condition starts with an emotion. Is this making sense so far? Again, this is the 30,000-foot overview, so it might be kind of way up there. If this is making sense, give me a number 1 in the comments box. Let me know it's working for you. Elizabeth, brilliant. Thank you so much. Appreciate knowing that that's the case. Okay, let's do several analyses here. Here's one. This is the first one. As a Jensenian iridologist, I would have told this person that he absolutely had congested lymphatics. I would have told him that he needed to do a lymphatic flush, and that if he did the right things, these lymphatic markers would go away. I would have told him that he had skin problems and that he needed a dry skin brush. I would have told this person, let's assume it's actually a female instead of a male. I would have told this person, this being a right iris, that she probably, as a Jensenian, that she had lung and breast problems and thyroid problems and liver problems and issues with the ovaries and testes and with the kidneys. I would have declared all of those things to be true. Now, for every client that I said those kinds of things to, 95% of the time, I was wrong. And even, you know, if they believed me that there was a problem there, because I believed me that there was a problem there, and put them through the paces of a cleanse and a flush and doing all kinds of high test work, we never ever saw the eyes change. So in constitutional iridology, by contrast, first thing we want to know is, what would you like my help with? So, and then I want to look at the overall constitution, and I want to make sure that I am assessing this person as a whole. This is really important. So once I know what this person wants help with, I'm going to look at the iris as a whole and see what it teaches us about the overarching inherent tendencies. So we would say this person has the predisposition of wanting to be over acid throughout their body. We would say they have a predisposition towards sluggish lymphatic flow and sluggish core lymph and blood circulation. Now, I can't say for sure that this person actually has those problems, because I don't know that until I've had a conversation with them. Maybe this person already knows their lymphatic system is prone to being sluggish and prone to not circulating well. So maybe they have adopted a very active lifestyle. Maybe they've cut out dairy and white flour and white sugar because they know, they've learned that those things can gum up their system. So I need to look at this in the context of what they've inherited genetically. And I need to then find out, what are they doing about it? What are their symptoms? So if this person actually had symptoms, if this person came in with a predisposition towards having swollen lymphatic glands or circulatory issues or a reduced immune response, we would use appropriate diet. We would teach appropriate dietary lifestyle, as well as lifestyle things like being physically active. And we would use appropriate supplements to get his body back on track. We would see the symptoms improve. And that's the important part. We would not see the irides change because the irides are inherent. So Evan is saying, wouldn't the venous congestion tell you they're having circulatory issues? The venous, the haze that we see at the edge of the eye, which is not in the iris, it's in the sclera, suggests that they are prone to reduced circulation. It doesn't guarantee they're having it. This is also an inherited sign. So maybe this person has no symptoms because they are physically active, they've got a clean diet, all that kind of good stuff. Maybe this person has symptoms because they are not doing those things, right? And so then we want to coach them as to how to do them. So nothing that we see in the iris or attached immediately to the iris is going to be a guarantee that they are having a problem right now. I just want to underscore that every case I've seen of reported iris changes have had one critical flaw. And that flaw is that those pictures were not taken with the same camera and the same settings on that camera. They've always used different cameras, different lighting, different resolutions. And if you know anything about photography, you know that the moment you change the camera, change a setting, change an f-stop, a shutter speed, anything, change any setting on that camera, you will alter the output. And you can therefore not use those images as before and after. I have 4 computer screens, 2 attached to my desktop, 2 laptops as well. And I can put the same iridology photo, the exact same photo up on all 4 of the screens, and they look different. The colors look different. So you have to know your tech in order to know if the before and after is valid. I've never seen before and after photos where the eyes actually changed. So there's a lot of indicators that we can use. Let's look at another set of eyes. In Jensenian, I would have said that this person was hugely toxic, that all of this stuff in here was accumulated toxins that they needed to cleanse, that with all of that cleansing, we could probably change these eyes to blue because there's some areas that are not very dark brown. I would have said this person is under a lot of stress and maybe heading for a nervous breakdown. I would have said this person absolutely has parasites and that they have skin problems. But, you know, for all the cleanses, the fasts, the supplements, and the diet changes I've supervised in over 4 decades, I've never seen pigment fade out. I've never seen these, what we used to call parasite lines, disappear. I've never seen contraction furrows disappear. I do know, however, if I took a picture of this same eye, and I do have it on file, I just didn't bring it up, and I have both of my lights on. This is a reflection, but if we had 2 lights this size on here, it would make many of these contraction furrows look like they weren't there. It would literally fill in those areas. So we know that pigment does not disperse with cleansing. We know that pigment is inherent, and whether it's these little teeny dots of pigment or these big washes of pigment, we know this is inherited. And we know that just as we can have age spots on our skin, there's a certain age at which my hair started to go gray. I'm pretty sure that was a genetic program. We know that even when pigment becomes apparent that wasn't there previously, that is based on genetic cues. Something has tripped a gene and has turned that on. The base color of the eye is a significant part of the Constitution. And that base color teaches us about the possible inherent health traits and health risks. So in constitutional iridology, the iris shows us inherent predispositions, and this one, because of its colors, shows us inherent predispositions towards liver insufficiencies, some potential for some elevated acid situations in the body. And we would ask this person liver-oriented questions. Again, this is where we need to know our A and P. We need to know what are the primary functions of the liver. How does the liver, when it's out of balance, create symptoms in other areas of the body? How does it affect other organs in the body? And so sometimes a symptom like headaches that we think, well, that's a head symptom. Sometimes that's actually a liver symptom. right? And so we need to understand how things connect. With an eye of this type, I am probably always going to want to do a little bit of liver support. It might be reflected in asking the client to have leafy greens every day. It might be that I teach them about some different herbal supplements they can use, and that I want them to rotate through a very low dose of these ongoing. These eyes are not going to turn blue, regardless of what we do. This person is not headed for a nervous breakdown, although they may be more prone to anxiety and depression. They might already know that. And if they already know that, they may be taking steps to prevent those kinds of problems. They may have learned cognitive behavioral therapy. They may be doing appropriate supplementation to minimize the risk of having those symptoms. They don't have to have those symptoms. Maybe this is a person who was raised in a very holistic home, has a very clean diet, was taught to meditate, was taught that when things get stressful, you take a break. Maybe they have mitigated the risk factors and have never experienced depression or anxiety. And that would be wonderful. They still have the predisposition, but they know what to do to prevent it. Is this making good sense to you? If it's making sense, give me a makes sense in the comments. Understanding the constitutions gives us so much of what we need to help us understand the client's inherent predispositions. Thank you for letting me know this is making sense to you. This eye suggests a predominant risk towards, again, some blood issues and some liver issues. Does that mean they have these problems now? Maybe not. Hopefully not. But as it turns out, this woman, based on the symptoms she brought in, actually likely has problems methylating her B vitamins. Now, I say that because right here, and it's really hard for me to show this to you. Oh, you might see it. Right here, there's a tiny brown pigment. And that tiny brown pigment, it's a different shade of brown. It's a darker brown than the rest of the eye, gives us the clue that she maybe doesn't methylate very well. She came to me looking for help with fertility. And one of the things we know is that women who don't methylate their Bs can't do folic acid and B12 properly. They need to have folic acid and B12 pre-methylated. We also know that women who don't methylate well have a much lower chance of getting pregnant. So as we had a conversation with her and her husband, and I saw that pigment, and we started asking questions, I learned that she had actually been diagnosed with type 2 diabetes and polycystic ovarian syndrome. Well, methylation problems are linked very closely to PCOS, and PCOS almost always includes type 2 diabetes. We did a lot of dietary work with her. Her diet was pretty bad. We got that cleaned up. We used a methylated prenatal vitamin with her and did a lot of dietary support. And she was able to conceive, delivered a healthy baby boy, and did not go into gestational diabetes the way the doctors had promised her she would. Now, a Jensenian iridologist, on the other hand, would have looked at this and said, yes, current liver issues, probably parasites, or definitely parasites, right? And they wouldn't have dealt with the methylation issue because they don't know that the brown pigment usually means, that extra brown pigment usually means methylation. Notice here that we also have a bit of a white haze at the edge of the eye. Now, a Jensenian would say absolutely has elevated cholesterol. Now, this client actually didn't have elevated cholesterol, but this can be either an indication. No, let me rephrase this. This is an indication this person doesn't handle their carbs well, that the liver's not handling that well. And when we see that, we then need to ask, does that mean the liver is taking these carbs into a blood sugar disorder, or is it taking them into a lipid profile disorder? Right, and so it was not a lipid profile, but it was an elevated hemoglobin A1C. So we knew that for her, this was an indication of blood sugars, not cholesterol. But again, we had to ask, and we weren't just going to assume that this was a Jensenian arcus senilis, and that this woman was setting down cholesterol and that was going to affect her brain. We needed to understand that this was something else. So constitutional iridology is a tool that helps us to have a deeper conversation with our clients. It helps us to understand where they're coming from, to understand what questions we need to ask, and to go a little deeper. Again, we have to have the A and P background to do this. Here we have a lovely lymphatic iris, and we see these little flecks of coloring here. These are genetic. We're not going to cleanse these away. These are not accumulated toxins. She wasn't exposed to a metal. She didn't take too many sulfa drugs. There's, nothing like that. This is simply an inherited pigment. The color of the pigment tells us which organ wants to be out of balance genetically. The placement of the pigment tells us which organs are going to suffer for that. Okay, and so as we look at this, we then need to correlate what we're seeing here to our client's symptoms. We need to understand those symptoms so we can think back through that physiological pathway of where did the symptoms come from, what is their origin, which of these markings correlates to the root of the problem, so that we know how to deal with it. Now, again, it's really important to remember that these may look different on your computer screen. On my desktop, they look very brown. On the laptop, they look like a faded rusty orange. And so we need to then understand that we should be looking at eyes directly. Use the image because it's easier than people sitting there with their eyes wide open and getting dry eye and things like that. But always go back to the person and have a peek at their eyes using a good pen light so that you can determine the color. Evan is asking, do you believe SORA correlate with where they are in the map? I hear conflicting information regarding hyperpigmentations. Yeah, so as we suggested earlier, the pigment itself tells us which organ wants to be out of balance. The placement of the pigment tells us which organ is likely to have a challenge. Okay. Constitutional iridology, we don't call these SORA, that is a Jensenian term. We call these simply pigment. In North American iridology, again, we would say this is a very toxic eye. So Evan, did that answer your question? They would say this is a very, very toxic eye, that this person had acquired a lot of stuff that they needed to cleanse. Again, we would say in Jensenian, this person's headed for a nervous breakdown. They are under a lot of stress right now. That is not true, not necessarily true. This tells us that this person is prone to internalizing their stress. That tells us then which nutrients they are likely to burn through more quickly. And it tells us what kinds of things we need to teach our client about how to manage their stress. We've got, again, a bit of that white milky film at the edge of the eye towards the limbus. And that, again, means we need to ask liver questions. We need to understand, is this the liver taking us into blood sugar issues or the liver taking us into lipid panel issues? Because how we work with those are very different. This is not anything to do with sodium, and it might not be anything to do with cholesterol. In constitutional iridology, again, the colors of this eye suggest a predisposition towards some liver imbalances and insufficiencies that could have an impact on the digestive system and could have an impact on how nutrients are transported through the body. These contraction furrows, in addition to saying this person is maybe a little bit prone to internalizing their stress, this is also a go-getter. This is someone who makes lists, the success of their day is determined by how many things they crossed off their list. And that, of course, is not even acknowledging that their list is probably too much for 5 people to get done in one day, right? But they are list makers, they are go-getters, they are shakers and movers. They get things done. These are the people that when they are healthy and well-balanced and well-nourished, they are the epitome of, if you want something done, ask a busy person. This is the person you would ask. All right. So when I see an eye like this, again, I'm going to ask first, what would you like my help with? And when I understand that, then I can look at the eye and I can assess the eye in terms of what my client feels her issues are. Right. So I'm not telling her everything I see that is potentially out of balance. I'm starting with what she wants help with. Because if I can help her get results, if I can help her get control of those symptoms, she's going to let me work deeper on other things. Does that make sense? Address the client where they're at, and then you can lead them to where they need to go. If you try to yank them over to where they really need to be, they're never going to stay with you. Okay. So here I would be asking questions about how she handles stress. I would ask her questions about how does she feel stress? How does it show up in her body? I would want to know, does she have carbohydrate cravings? I would want to know if she'd had any recent, like a hemoglobin A1C. Does she have a recent lipid panel? And we need to really then dive deep into those directions to understand where we need to go. So Kim Marie on the webinar is saying great info on how to handle the client at their needs. It is so important, Kim. Thank you for commenting on that. So again, we do want to know what their past history is. We want to know where they've come from. We want to know their family history, because remember, the irides are inherited, and that means we are looking at information that goes back 3 to 4 generations. So how much of that is actually being seen, being experienced in this person's body? So we need to have that conversation so that we can understand which markings are important and how to work with this client. Is this a client who really just needs someone to listen to them? Is this a client who needs vitamins and minerals in specific formats? Will they respond better to herbs? What about dietary changes? Are they willing to make some lifestyle changes with activity levels or activity types or meditation or getting a massage and doing some self-care? As we understand more about the eyes and as we have that conversation with the client, it helps us to understand better how to support them, how to coach them. Again, a North American iridologist would say this person had lots of parasites that we need to cleanse and cleanse and cleanse, but parasites are not genetic. Parasites are situational. And you can have 2 people that have different eyes, one that has different kinds of markings than this even, expose them to parasites, and one will hold on to the parasites, the other one won't. And some of that is because of what we see in their eyes and what we see for weak links. Some of it might be because of nutritional status, right? There are many reasons people hold parasites, and this is not a parasite line. This has nothing to do with parasites. This was in this eye from the moment of conception. This simply tells us that there is an interruption in the nerve feed that may impact the digestive tract, and there may be a weak link, possibly in the intestinal tract, where this person could hold parasites, but it's not a guarantee. You will never ever see a solid indication in the iris that the person has parasites. You might want to ask questions. If this is a person who has worked with a lot of animals that lived out of doors, this is a person who's traveled a lot to third world countries or done a lot of backcountry camping where they were drinking mountain water, you might want to ask them parasite questions to ascertain if their symptoms are indeed correlated to parasites. But I would ask them those questions whether I saw these markings or not. You know, if this client was saying they had just gotten back from, oh, I don't know, Costa Rica or Honduras or somewhere like that, and they had been backpacking in the mountains over the summer, and now they've got these weird symptoms, I'm absolutely going to ask parasite questions regardless of what I see. Constitutional iridology, instead of focusing on, oh my goodness, you're headed for a nervous breakdown and you're full of parasites, because we don't believe that, would say this person again responds more in the sympathetic nervous system. So they tend to respond strongly to stressful situations. They internalize their stress deeply. And so we need to help them with that. When people internalize their stress, it often takes a toll on the adrenal glands. Here's that connection of knowing your A and P. When it takes the toll on the adrenal glands, well, what do the adrenals control? They have a huge input on the kidneys and the blood pressure. They have a huge input on regulating inflammation. Are these some of the symptoms the client is experiencing? And if they are, we can track it all back to the adrenals and to how this person deals with their stress. And we can, again, appropriate supplements, appropriate food choices, appropriate timing of meals, appropriate self-care to get to the root of the problem, right? We may want to be using B vitamins or make sure their blood sugars are balanced, because blood sugar impacts the stress the adrenals feel significantly. Every client that I see that has eyes like this doesn't need the same recommendations. And this is why I never do a carte blanche free iris assessment, because I don't know what that client's lifestyle is. Even if I know their symptoms, I need to know their lifestyle. I know that this person runs the risk of overreacting to things that I say. And so I need to choose my words very, very carefully to avoid sending them into an anxious overreaction. I always need to be anchoring everything to the idea that they have control. There are things they can do that they have power over that can help us to mitigate the situation. When we look at things like these larger markings that break the collarette, that again tells us that we likely have some interruption in the nerve feeds. But this client, again, only needs to hear what they need to hear right now. They don't need the whole story. So another question regarding the arcus lipoids, I think you called it something else. Yeah, we would call it a lipemic diathesis. If it's not a cholesterol or a hemoglobin A1C, do you think it could be related to calcium? No, cataracts are in the lens. Cataracts are not in the cornea. So this is not going to have a link to cataracts. We don't see cataracts with the equipment we use. All right. How are you doing with this? Are we good? We good so far? We've got a few more of these to do. I don't know we're going to get through all of them because I teach another class at 12. So we'll see how far we go. So did that make sense for you, Evan? The next layer of information we consider beyond that base color is the fiber structure. In constitutional iridology, we were taught that every one of these is a pathological problem happening right now, and they each needed to be addressed right now. We were also taught that if you address them, these would go away. We were taught as well that the fibers that we see inside these are healing lines. Wrong on all counts. And that might sound like a bold and harsh statement, but it is wrong on all counts. The iris is made up of layers of fiber, a trabecular structure that is made up of all of these things that we see. So what we're looking at here is a separation in the top layer of fiber, and we are seeing the next layer of fiber that is below that. They've always been there. They're not going anywhere. We're not getting more of them. We're not getting less of them. They've always been there. When people say they see these change shape, what they are usually not accounting for, no, what they're always not accounting for is the size of the pupil. When the pupil is very small, this gets stretched out. That's going to make these lacunae look longer and narrower. When the pupil is very large, the tissue gets compressed. And just like if you had a long, thin balloon and you started to squeeze it, it's going to get fatter. These will get fatter when you push on this end. The volume is going to stay the same, and this is going to get wider. And so these are going to not change as a response to anything you do. If we assessed each of these, this person would have issues with their brain, their pituitary, bronchioles, adrenal, kidney, perineum, rectum, bronchus, parathyroid. Yeah, when I used to tell clients that, I often would think, and I have friends that own a funeral home, let me give you their business card, right? Because where's the hope in this? Constitutional iridology says these are inherited. They may or may not present active problems or active risks right now, and this is why we need to ask questions. These markings are handed down 3 to 4 generations. And so we need to know, is there a personal or family history of problems sitting right here. So this is a right iris. This is a right iris. So is there a personal or family history of heart and lung issues? And if the client says yes, then I'm going to keep that tucked in the back of my brain. If my client has not come in for heart and lung issues, I'm not going to address it directly. I'm not going to slap them in the face with what I want them to work on. But I am in my recommendations going to tuck in some things very gently that will be helpful here. Heart and lung, I might suggest, depending on what else they're working on, can you incorporate onions, garlic, and broccoli into your diet several times a week? Because we know those are things that support the heart and lungs, right? But I'm not going to say, oh my goodness, you've got these giant lacunas sitting in the heart and the lungs, and oh my goodness, look at, we've got some honeycombing inside there. You're in deep trouble. You're going to die. I'm not going to do that. Instead, I'm just going to say, yeah, there's some really great nutrients in onions and garlic and broccoli that can be very helpful for a lot of things. And so how do you feel about incorporating that? And I'm going to leave this alone as a direct approach until the client is ready to work on that. Does that make sense? We need to show restraint here. In North America, every iridology or every fiber is critical in North American iridology, and every errant fiber, every fiber that's not doing exactly what we want it to do, that's not radiating straight outward, is a significant problem that needs to be addressed. But when we look at this eye, again, we've got one transversal, two transversals, another 3, 4, 5, let's see, 6, 7. We've got so many, it's like the previous eye. We'd be giving this person a remedy for so many things. But with holistic constitutional iridology, again, we think of the person as a whole. What do they want help with? What do I understand about what these transversals could mean overall and individually? And which ones of these are the most important for us to pay attention to based on what the client wants right now? Now, sometimes I have a client where, particularly if we've done 4 or 5 sessions already, I will go deeper and I will go a little bit where I want to go. I'll pull their pictures up on the computer and I'll say, we've been working on this, this, and this. You've been getting great results. Now, would it be okay if I drive the bus for a while? Because there's some things here that I think are pretty important. And because by then I've earned their trust, they're getting results. They know I'm not going to say something to scare them. I'm going to speak the truth. They are usually very open and very willing to let me drive the bus and take them where I think they should be going. But again, we need to understand where our client is mentally and what they are capable of as far as changes when we're making our recommendations. And we're always looking to get to the root of the problem. A North American iridologist would say this person has a weak constitution. How would that make your day? You've got a weak constitution. No one needs to hear that. Conversely, no one needs to hear they've got a strong constitution because, and I'm just going to flip back, this person in Jensen would have a strong constitution. Problem with a strong constitution is that these people often feel really good and really abuse their bodies until they're about 45 or 50. And then they've done so much damage that they're starting to fall apart and they don't understand why. So I never tell anyone they have a strong constitution. I tell them they have a constitution that is willing to work with them. If they do the right things, this body will respond more quickly. This person is going to need to work harder and longer to get results, but I would never say they have a weak constitution. No one needs that downer. Instead, I will simply say they've got areas that need more attention. And again, I want to know, what are their symptoms? How does the eye correlate? What does that teach me about where we need to begin? And so, for example, with this person, when I see that we have this predisposition to a lower resiliency, this is going to take these areas, if they've got symptoms, It's going to take more time and more focus to get results. But for me, the weakest link here is their digestion. So I am going to tie it back and say things like, teach them about what these markings mean. Again, if this is where they've got symptoms, and I'm going to say, but it won't matter what I do for these areas if we aren't supporting your digestion, if we're not helping you break your foods down well so that you can assimilate those nutrients, then I can give you the nutrients that can support these areas that are asking for help. How do you feel about doing it that way? And when we do it that way, they're going, oh, you mean you're not just going to give me the magic bullet? Nope, I'm going to help you build health. If you want a magic bullet, that would be a prescription from the doctor, but you're here. That suggests you want something different. And they always are really on top of that. Yes, I don't want to be on meds all my life. I want to get control of this. Iridology helps us understand those foundations. When we are doing an iris analysis, the map is the last thing we use. We look at the color first. We look at what color the pigments are, if there are pigments. We look at the fiber structure. We correlate all of that to our client's symptoms, and only then do we actually take it to an iris map. And sometimes I don't even need to go to the iris map in the first 2 or 3 appointments, because the Constitution is telling me what I need to know. And really, you can do a solid basic first assessment or 2 just on Constitution. Did you notice that I never once in any of these eyes focused on every little thing that shows a challenge in any way, shape, or form? Did you notice that I didn't dissect this eye down to the minute detail? If you notice that, give me just give me an I noticed in the comments. Let me know that you noticed that. We are looking at the person as a whole, not as individual symptoms. Does that make sense? All right, so let me introduce myself at a deeper level. My name is, again, Judith Cobb. I'm a master herbalist, a natural nutrition clinical practitioner, and a level 3 certified iridology instructor with IPA. Level 3 is the highest credential you can earn as an instructor, and I'm one of only 5 in the world, so that's pretty cool. I've actually been a certified iridologist and instructor with them for more years than this, but they update our badges every 2 years, and so that's what I've got here. In my 4 decades in the industry, I have written several books, self-published and self-distributed them. Pregnancy Naturally, the Herbal Birth Kit Handbook, Healthy Kids Naturally, The Essential Guide to Nature's Sunshine Products, Biokinesiology and Color Therapy, Level 1 and 2, and the Confident Nutritionist Dynamic Iridology textbook. I've also designed courses for each of those because teaching is my other passion. My first passion in my clinic is working with fertility, high-risk pregnancy, breastfeeding issues, and menopausal issues. My second, and then my first passion outside of the clinic is teaching. I am affiliated with the Canadian Association of Holistic Nutrition Professionals and the Canadian Association of Natural Nutrition Practitioners and the Alberta Herbalist Association. What I love about all of these organizations that I'm affiliated with is, in order to maintain my professional affiliation with them, I have to do upgrading hours every year. So I'm always researching and reading and studying and attending classes and workshops to keep up to date. Now, obviously, if teaching is my passion, I want to tell you a little bit about the Dynamic Iridology course. We're not going to spend a lot of time on this. The next course does start on January 12th, and the class time will be noon till 2:15 p.m. Mountain Time. So use your international clock, your world clock in your phone, or use a time date converter on the computer to figure out what time that is for you. If you are a health professional, and I define that as anyone who has got a college level anatomy and physiology course under their belt already, and if you're interested in learning iridology deeper than what I've gone into today, because how deep can I go in 30 minutes, right? Then we should have a conversation. If you're interested in learning how to use iridology, not just to do an assessment, but to help you in creating client programs and to create those client programs quickly and easily while you are with your client, rather than, I know a lot of nutritionists go off and spend hours creating programs to bring back to their client. If you want to get your work done while you're with your client and learn how to build programs step by step so you're never overwhelming your client, then we really do need to talk. If you don't already have A&P, shoot me a note and I will send you a link to the course that I send my students to. I will be developing my own A&P course in the next year, but for now there is one that I do send my students to because it is a very solid program. This is what one of my recent grads said. This is Joyce Lee. She is a certified esthetician, clinical aromatherapist, chartered herbalist, and a nutritional consultant. She says, I took an iridology course from another school a few years ago, but I was left feeling inadequately trained with no confidence in the material or my abilities to perform accurate assessments. Judith Kopp, on the other hand, is a wonderful instructor. She presents the material in this course in a concise, organized way. Every aspect of this iridology course is covered in detail. She clearly answers every question asked, no matter how trivial the student may think it is. Judith structures the classes in a way that makes them incredibly interesting. Clarification is clearly established through her instruction, discussion, and student participation. Upon completion of Judith's course, I feel very confident in my abilities and excited to offer iridology services to my clients. This course is an incredible value and highly recommended. So I love that she already had some training, but it wasn't working for her. I hear that a lot. Here's another one of my grads. He is a naturopath and herbalist in London, England. Adam, he goes by Adam. He says, having had comprehensive iridology training in the past, I can attest that the dynamic iridology course is well-rounded and covers all the necessary basics embellished with the teacher's own experience and discoveries. The course is taught from up-to-date information, and it is clearly apparent how much work she puts into staying in the forefront of iridology research. The hidden gem in this iridology course is the ongoing support that Judith kindly offers. And what he's meaning here is even after you complete the course, we have mentoring options that are just given as a gift, which I find to be an invaluable gift and resource. So the mentoring is, if you've got a business question, if you've got a case you're working on, we have group mentoring for my students and grads twice each month. You bring your questions, you bring your cases, we discuss them, and we support you no matter where you are in the course or how long ago you graduated from my course. This is only open to graduates of my course. So the Dynamic Iridology Assessment System is the only live, online, fully mentored course for nutritionists, herbalists, and naturopaths who want to streamline their clinical work without sacrificing client care, so they can stop working unpaid overtime to develop client programs, so they can stop overwhelming their clients with undoable programs, and create programs that will increase client compliance, success, and long-term retention. Isn't that what we want? Is to have our clients want to keep coming back for the long term. I've got clients that have been with me now for 4 decades. They stuck with me through those early years at Jensen, and they are still with me now. They come in 3 or 4 times in a row for a few months, and then they're feeling great, so they disappear for a few years. And then when they start to age and things shift, they come back for a few more sessions. And I love that I've got these long-term clients that we have such a great rapport. The goal of this course is to teach you constitutional iridology and how to use it confidently so that you can easily integrate what you already know about nutrition and herbology to confidently create doable client programs in your paid client sessions. We practice integrating this into your work. That is what we do as a part of our training. It does no good to learn iridology if you don't learn how to use it, right? So if you are interested, oh, I didn't change this slide, disregard this date and time, my apologies. Registration for the January start date is open. If you have A&P under your belt and you're thinking, yeah, I'm interested, I want more information, I want to get on that wait list, then use this URL, tinyurl.com/dynamic-iridology-insight. Schedule a Zoom video call to talk with me. This is not a high pressure sales call. It is simply an opportunity for us to have a conversation about where you're at, where you want to go. And if I feel like it's a good fit for you, then I will invite you to enroll. If I do not feel like it's a good fit for you, I'll direct you in another way, right? But you have to have the A&P under your belt first before you book this call. Alrighty, so with that, my friends, thank you so much for being with me today. I truly appreciate it. That is what I've got for you. I'm looking forward to speaking with some of you on calls. I see some familiar names from the Facebook group and from my email database. So I look forward to having calls with you and to seeing if you're going to be with us in the January course. Have a fabulous day. We will talk to you soon. Bye for now.